Everyone, today we are going to start the topic which is a typical cervical vertebrae, which are C3 to C6. I'll show you which is depicted here. This is C3, C4, C5 and C6. Now what are the differences between the typical and atypical? As I said in the earlier video also, but still we would revise it here. Body is small, okay, and has an uncal process. I would show in the diagram in the vertebra where is the uncal process, and body of adjacent vertebrae are connected by the secondary cartilaginous joint. Now these bodies are, this is a body part, okay, this is the body part. See, you can see from here, this below part, like superior surface is concave and inferior surface is convex. That's why it is able to hold, but in between this there is an intervertebral disc, don't forget this, okay. And this vertebrae are connected by secondary cartilaginous joint and the intervertebral disc with the nucleus pulposus in the middle and annulus fibrosus at the periphery. Now this intervertebral disc, sorry, now this intervertebral disc has a nucleus pulposus inside, and surrounding it is surrounded by annulus fibrous rings. One more thing, this nucleus pulposus, which I said, nucleus pulposus is a remnant of notochord, okay, don't forget it is a remnant of notochord. Now there is a joint between the uncal process. Now see, I would draw a vertebra. See, this is a body, okay. Here on top of this is a uncal process, like this. It is concave a little bit and this is convex. Now this is the uncal process, okay. Now this process is joined by a joint of Lashka or oncovertebral joint are present between this intervertebral disc. The pedicle arises from posterior lateral side of the body, midway between upper and lower margin. Now I'll show the pedicle, okay, just a minute. Now this is the C3 vertebrae, okay. On this we would study all the different structures. This is the C3 vertebrae. This is the uncal process which I told you. This is the uncal process, okay. This is uncal process. Actually it is unicate process. I'm saying it uncal process because I've seen it, I've listened it. That's why unicate process. If you open any book, atlas book, or any pictures book which you refer for anatomy, in that diagram, in that picture, it is depicted, it is pointed as unicate process, and on it there is articular surface of unicate process, okay. Now this is the pedicle which I'm showing. Wait a second. This region and this, okay. This is the pedicle of vertebrae. Actually it is a pedicle of vertebral arc. It arises from posterior lateral side of body, midway between the upper and lower margin. It arises from posterior lateral margin. It arises from posterior lateral side of body between the upper and lower margin. I'm repeating this because you don't just listen, don't just see it. Open your books, just observe it from that book also, because sometimes when we are watching any video, we are listening something, like without our knowing, subconsciously we think about anything, like randomly thoughts come in our mind. That's why it's better to open your book and just compare the things which I'm saying, so you could focus on your content also, and you won't waste your time, okay. Now the lamina is a thin body plate. They are directed backward and medially and extend behind as a spine. Now Now the lamina, which is a thin body plate, they are directed backward. See, they are directed backward. Okay, they are directed backward and medially and extend behind as a spine. It extend behind as a spine. I always tell you the spinous process of a cervical vertebrae is bifid. Later you might have a confusion, or you might forget that which spinous process has a bifid process. It is a cervical vertebrae, don't forget. They are connected with the lamina of adjacent vertebrae above and below by the series of fibroelastic ligamentum flava. Now these spines are connected upward with the another spinous process and below with another spinous process by ligamentum flava. Okay, and spinous process is bifid and gets attached with ligamentum nuchae. The superior articular facets are flat and backward, faces backward and upward, and inferior is directly reciprocal, which is forward and downward. Now superior articular facet, now these are superior articular facet. Okay, these articular facets are flat and faces upward and backward. Don't get confused. It's dancing in between. Superior articular facets, it moves backward and upward, and inferior articular facets are reciprocal of it, which is forward and downward. Okay, the articulate to form a plane of synovial joint to perform a limited movement of flexion and extension. The transverse processes are directed laterally. Each processor has transverse foramina as a thin is a characteristic feature of any cervical vertebrae. Keep in mind, it is a characteristic feature of any cervical vertebrae. Now this is the this is the transverse. This is the transverse foramina. It is important, later you would know why it is important. And it has two tubercles. One is anterior tubercle. Transverse process has anterior tubercle and posterior tubercle. This is transverse process. Okay, it has two tubercle, which is anterior and posterior, and it has a transverse process. Okay, till here it is clear? I hope so. Each foramina transversium has an anterior root and posterior root, posterior tubercle, and between these two tubercle runs a costo-transverse bar. Okay, I told these things. The anterior root and anterior tubercle, costo-transverse bar, and the posterior tubercle, these four things represent the costal element of the cervical vertebrae. Now, which all elements represent the costal element? 1 second. Costal elements. These, it is formed by anterior root, anterior tubercle, and costo-transverse bar, and posterior tubercle. Once again. Costal elements. Costal elements represents which four things? Come again. Anterior root, anterior tubercle, costo-transverse bar, and posterior tubercle. Okay. Now this is about C3. What about C6 anterior tubercle? In C6, anterior tubercle is important. How? Anterior tubercle of 6th cervical vertebrae is a prominent because it is called a carotid tubercle because common carotid artery passes from the anterior tubercle. Okay, don't forget this. Common carotid artery passes from anterior tubercle. Okay, don't forget this. And it can be compressed against it by given a deep pressure. The anterior tubercle gives attachment to 3 types of muscles. Now this anterior tubercle gives attachment to 3 types of muscles, which is longus scoli, longus capitis, and scalenus anterior. Okay, scalenus anterior. And posterior tubercle provides attachment to scalenus posterior and levatus scapulae. Okay, now till here we understood about the cervical vertebrae of atlas axis of C3 C6, but see, about C7 we have not seen that much in deep, but still I would tell you and explain you in this video about 7th cervical vertebrae. Okay, as I told you, 7th cervical vertebrae is also a vertebrae, has a vertebral is also known as a vertebral prominence because of long spinous process. Okay, its tip can be felt through the skin at the lower end of the nuchal furrow. This I told you already in the last video. Spine is thick, long and horizontal and not bifid and has a tubercle at end. This is important. Spinous process of C7 is not bifid. Okay, keep this in mind. It has a tubercle at end. Transverse processes are comparatively large. Specifically, posterior part is larger than the anterior part. Okay. The foramen transversum are very small compared to typical vertebrae. Foramen transversum are small as compared to the typical cervical vertebrae. Okay. The tip of the spinous provide attachment to the ligament of nuchae, which I told you. It is common for every spinous processes, and certain muscles which are certain muscle attachment of C7. Trapezius and rhomboideus minor, splenus capitis, semi spinalis, cervicis and multifidus. Now one more thing. As I told you, common carotid artery passes from the anterior tubercle of 6th cervical vertebrae, right? Now if someone asks the location of the artery, like common carotid artery, it passes from which cervical vertebrae, you should tell from anterior tubercle of the 6th cervical vertebrae. Don't get confused. Some might get confused and say 7th cervical vertebrae. No, the foramina transversum of C7 transmits only accessory vein and not the artery. Foramen transversum of C7 only accessory vein pass. Okay, till now it was about all the details about the 7 cervical vertebrae. And one more thing, transverse process has a large posterior root and laterally has a posterior tubercle, and this provides attachment to suprapleural membrane. The anterior root is thin and small, and sometimes it may be enlarged and form a separate bone, and we call it as a cervical rib. Okay, now these things I've said, many things I've said, many things I've written, might be maybe some not and may not understand the handwriting what I have written on this. So please listen properly, keep your ears, eyes, mind, everything open, focus on one thing. If you give a little time, just a small content also gives you most of the information. Okay, it won't waste your time. So focus on your studies, do well. If you have any doubt, please do comment. Keep watching the videos, I would post videos continuously. So thank you. Till here I have completed till 7 cervical vertebrae. I would go to thoracic vertebrae. Side by side I would post any another videos also. So do watch, don't miss anything. Take care. Bye bye.